Hello everyone, and welcome to this audio podcast as part of this Traadax Fissure. This audio podcast in around the Traadax Fissure intermission. This intermission aligned to a Traadax Rupture and a chartered edition and evidence-based perspective. This is another Storm Robotics production. In this overview, as part of this audio podcast, what as part of this audio podcast, I thought it'd be a sort of a good, a sort of sort of sort of a point to go to reflect on the sort of the sort of workshop sort of activity that had taken place in around this in around a sort of a workshop sort of effort that took place by the or organized by the British Islamic the British Islamic Medical Association, and wherein the British Islamic Medical Association had organised an effort to a sort of a collaborative sort of workshop wherein organisations such as Kidney Research UK and Blood and NHS Blood and Transplant with the British Islamic Medical Association or BIMA had actually had collaborated to who collaborated to co-develop who collaborated to co-develop a media in around highlighting some of the sort of underpinning and underlying bases and stories, real sort of lived stories, real stories in around transplantation, from different perspectives. And the workshop brought together sort of colleagues and collaborators from different aspects of healthcare of healthcare and clinical practices, to highlight to highlight aspects in around transplantation, and at the same time the the so so in following in following a previous audio podcast in around a Traadax Fissure and Traadax Fissure intermission. The this audio podcast, this in around this Traadax Fissure and this sort of intermission, to highlight again really in around this collaborative effort between the BIMA Kidney Research UK and NHS Blood and Transplant, wherein the organisations, from a collaborative effort, sought to highlight the works in around transplantation, where the British Islamic Medical Association, British Islamic Medical Association, had highlighted sort of real stories through a film premiere, a film sort of a film premiere highlighting wherein different stories around transplantation were part of the film, part of the media that had been shown, or that had been highlighted. And there were colleagues and collaborators from from an academic institution to an academic institution, and colleagues from from the sort of the surgical and around the surgical bases around transplantation, and colleagues from sort of from a particular specialty in around clinical practice, and also where there was a guest sort of patient perspective in around this workshop, and the film premiere in around the film premiere the in around the film premiere there was a sort of a basis in around where there was a sort of an introduction from one of the senior colleagues of the British Islamic Medical Association, a perspective from in around sort of transplantation in ethnic minorities, from one of the nephrology trainee colleagues, and there was a sort of a panel. There was a panel discussion by sort of the by sort of surgical colleagues and intensivist colleagues in around clinical practices, and also from a faith perspective in context of in context of in context of the in context the works in around transplantation, and in part of this as part of this sorry as part of this workshop, there was a there was a sort of a reflection, really a reflection for those who who sort of practice a practice in context in context of clinical and healthcare practices, but also aligned to transplantation, and aligned to looking at transplantation, and wherein the film that was sort of premiered as part of this workshop that took place in March, in March 2023. There was a sort of a reflection from all in context of transplantation, and looking at aspects of faith, and so one aspect that was important was, or that had been highlighted, is that, for example, if the body if a body part is used for the same purpose or function that God had created it for, then in situations of necessity it is permissible to use part of the body, and regulated organ transplantation services usually satisfy all of these sort of bases, and hence the use of, for example, human skin for burns and bone marrow transplants are considered permissible in cases of necessity, and donating organs in context of transplantation is not about ownership, but about whether, for example, donating them defiles aspects of dignity, and there is a moral distinction between, for example, a moral distinction and in between, for example, between selling, selling organs and donating organs, and with respect to violation in context of dignity. And when someone when someone wants to donate organs, for example, ownership of the organs is not transferred, um, as the organs are on the as soul based soul based entities, soul based entities. They they uh, they 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 are not uh, they are not they in context of in context of where, for example, again, in around necessity, where it's where an organ can help, potentially can potentially help can be is implied and is applicable in aligned to life saving treatment, or a part of life saving treatment, and sort of care pathways. Then in this context, it is where donation differs in that an exchange is not made, a price is not attached on the organ, and there is no material gain. And so the the workshop, in around the workshop and the film premiere that took place, there was also a basis in around in around the aspects in around legislation, and some works in around the in around aspects of consent as well. And so in around the basis around the UK, for example, the United Kingdom, and transplantation and law, the in different parts of the United Kingdom, there have been sort of tried and tested aspects in around the opt out, the opt out aspect, the opt out aspect of the pathway. And it was in December 2000, in around December 2015, there was this the sort of soft out basis of the opt out system in Wales, in the United Kingdom. In July, it was in around it was in around 2000, in around July 2019. Scotland had prompted or propagated the opt out an opt out basis as part of the aspects of law in Scotland. And in May 2020, there had been some policies and some works in around the opt out system from the United Kingdom. The United Kingdom United Kingdom basis in around May 2020. And in prospectively, there's the basis the sort of basis in around the opt out system is generally is that unless you have a sort of a recorded decision not to donate in context of transplantation, or included, or are in in an excluded group, it will be considered that you agree to be you agree to be an organ donor when you die, when you pass away. And you still have a choice if you want to be an organ donor or not when you die, and you can record a decision on aligned to the NHS organ sort of donation register. And in around the workshop as well, there was a basis where where collaborators had highlighted some works in around the sort of the faith sort of focused questions in around organ donation and transplantation, wherein there was wherein as part of the workshop, there was an example where, for example, there was an example from in context of where where someone where an individual looks to put themselves on the transplant on the organ donation or transplant sorry, on the organ donation register. There is now, or there has been, a faith focused sort of question, which sort of retrospectively had not been the case. So the question, the basis is, for example, I would like NHS staff to speak to the National Health Service staff, or NHS staff to speak to my family and anyone else appropriate about how organ donation can go ahead in line with in line to faith and beliefs. And then and in as part of the and part of the question in this on this as part of the organ donation register, for example, there is a basis in around, for example, yes, this is applicable to me, and no, this is not applicable to me. So the ODR or ODR the ODR or the organ donation register has a faith a sort of a faith focused question in this. And in this is a sort of an opportunity for an opportunity where between sort of health professionals and who um who who seek to donate, who seek to would like to donate organs for their organs before passing away. There's an opportunity through the ODR, for example, a where the where the where individuals can have a discussion in around aspects of the in around aspects of intent, in around aspects of intent, and where there's an opportunity to recall whether an individual would want to discuss aspects of faith and beliefs with health professionals, and where health professionals have the opportunity to communicate some aspects of the ODR in around the ODR with family members when they approach them when approached in around transplantation. For example, the workshop at the same time had had um, had had highlighted some aspects around sort of had aligned some aspects around prospective sort of aspects that would follow on from the collaborative works that had taken place to ha having sort of developed the sort of film premiere, which in itself will be is or should be available online through the British Islamic Medical Association at some point if it is not available already. But within the film, within the sort of film premiere, there was basis from various perspectives in around sort of in around aspects of transplantations from patient perspectives, but also from health professionals who highlight sort of different aspects around sort of transplantation as well. And it was the film premiere was quite sort of in depth for about the sort of 20 or 30 minutes that the film premiere went was sort of running for. The the uh, the sort of works that colleagues and collaborators had highlighted through the workshop that took place as well would be that there would be sort of a basis in around sort of more efforts in around sort of public based events in around transplantation and sort of faith-based views, peer education and support within support in around and within different sort of communities, and encouraging conversations with sort of families and friends as part of prospective sort of works from collaborate colleagues and collaborators who organised the sort of film premiere, and also where the colleagues and collaborators highlighted sort of where there would be a sort of open access to information in multiple languages in around transplantation, and colleagues and collaborators had highlighted that that retrospectively there had been information made available in multiple languages, for example, from NHS Blood and Transplant and sort of and through also Kidney Research UK or KR UK, sort of retrospectively in around sort of specific works that had taken place, and and at the same time where colleagues had highlighted that there had been some issues in some regard with works that have been sort of co-developed retrospectively in around transplantation in multiple and where information in around transplantation is available in multiple languages. However, there have been issues in sort of accessibility from public health perspective, and also where retrospectively there has not been any there have not been any sort of works that have been sort of developed to highlight or highlight, for example, where information in around transplantation in multiple languages, for example, is has been sort of critiqued to sort of inform and affirm, for example, that information is sort of for example, again, number one, accessible, but also number two, also where it's user and reader friendly, for example, as well. And this then this the workshop in line to the workshop and the premiere, the film premiere that took place. There were some discussions that took place as well. So, for example, where between the panelists and the audience as well, there were questions in around, for example, what could be done, what more could be done to see sort of different aspects of, for example, the film premiere being disseminated, but also in line to where there was discussions in around sort of the educational points and perspectives, and there were points, for example, that in sort of schools, for example, in secondary schools, and also in from at sort of community or at primary care level, or at a primary care basis. There was discussion and points where, for example, that health professionals themselves should potentially seek to actually to actually sort of immerse themselves in sort of the in the in sort of propagating the educational aspects around transplantation, sort of at grassroots, being for example in schools, in around secondary education, at secondary education level, in schools, and where, for example, primary care physicians, and other healthcare professionals, for example, or could, for example, have part of their, so for example, as part of their continuous professional development, or CPD, part of their CPD, where, for example, they go into sort of secondary schools, and also in around sort of in around in aspects of communities or different communities, for example, and where the from an educational basis that they highlight different aspects of transplantation from different perspectives, and approaching in sort of secondary schools, and in for example in surgery practices, as well, in surgery practices, and also where for example a lot of the works in around peer education, and transplantation has often has focused has focused on, for example, where patients sort of highlight different aspects around transplantation, as was the case in the film premiere that was part of the workshop. However, at the same time, to the sort of the discussions that took the part of the discussions that took place were that it is important for health professionals, who work who are involved in different aspects of the transplant, in different aspects of the transplant in around transplantation, that these health professionals it is these health professionals that should be and could be more involved, at sort of grassroots, providing a basis to providing a basis to those in different parts or different aspects of community and primary care, so that for example, in around the opt out system, there had been a basis where sort of his sort of retrospectively, there had been a basis where the opt out system had been had propagated in some way, for example, where it was or had been almost sort of on the lines of scaremongering, for example, where we're going to take your organs unless someone unless someone consents, unless someone consents that they do not want their organs to be used for transplantation, for example. So in this context, it is important that health professionals themselves are involved at grassroots to provide the educational basis in around transplantation, and around in aspects of in around transplantation, under transplantation, the and where and where where health professionals should and could, for example, also be highlighting aspects in around the opt in versus opt out, and different sort of works that have been peer reviewed and published in around that as well. So the film premiere was really exciting. There was a sort of opportunity to highlight and discuss different perspectives from those who attended. The workshop was set to take place at an earlier time before. However, there have been problems where, for example, owing to the pandemic and COVID-19 had caused some restrictions, wherein the organization, the British Islamic Medical Association and collaborators, for example, had to reorganize, and so this was an opportunity for those who attended to sort of discuss different aspects, and the organizers are have online as part of their works, where the film premiere will be highlighted in another part of the United Kingdom, around the United Kingdom, prospectively, as well. And so, as part of this, as well, as part of this, I also I, as part of this, some aspects around the human tissue authority, is important. Generally, the Human Tissue Authority, or HTA, is an independent sort of regulator of organizations that remove, store, and use human tissue for research, medical treatment, post-mortem examination, education and training, and display in public. The organization that is the Human Tissue Authority, also sort of give approval for organ and bone marrow donations from living people, and they monitor, inspect, and sort of regulate organizations. Then the HTA also publish sort of findings, and where there are sort of shortfalls, the HTA, with work with organizations to ensure that improvements are made against sort of action plans. The HTA HTA was initiated by a Parliament in the United Kingdom as a non-departmental public body, of the Department of Health and Health, of the Department of Health, and are overseen by an authority of lay and professional members appointed by government. The vision that HTA generally have, is that they believe that patients and families will have more confidence, that wishes will be respected, that organs and tissue used in and for treatment will be safe and high quality, and that tissue used for research or other purposes will be put to the best possible use, if they know that there is a regulation, if there is regulation in around human tissue and organs. And by fostering an environment of trust, the HTA hope more people will donate tissue for scientific and medical research, organs for transplants, and bodies for sort of medical education and training. On that basis, the HTA Human Tissue Authority also can, at the same time, can help, seek to help healthcare sort of flourish as well. The HTA have a website, and so if there are any listeners out there who want to know a bit more about transplantation, and legislation around this, the HTA website, is accessible, and the HTA have a there's a basic list in around bodies, organs and tissues and cells that can be used for many purposes, and there's a list in how in how and how the in how the HTA are a basis in around in around aspects of the sort of authority in around the authority and around transplantation and the different and in meeting certain particular sort of objectives around transplantation as well. So the HTA sort of website highlights some more details as well. So here I thought that it would be an opportunity to highlight a little bit around the HTA in line with the workshop that took place as well. So that draws that excuse me, that draws this audio podcast to a close. This has been a Traadax audio podcast aligned to a Traadax Fissure, a part of a Traadax a Rupture, a chartered edition and evidence-based perspective, an audio podcast aligned to a Traadax Fissure and a Storm Robotics production, and an audio podcast as part of a Traadax Fissure intermission. Thank you.